for me, one of my biggest symptoms of MS is pain. And it particularly was bad at night. And so when I started in with the patches, I started in with X39 and Icewave, or what I started with. And I was just blown away by the way that Icewave works so effectively. For me, the first night, about 50% of my pain was reduced. And then the second night, I moved it around a little bit. There's great information on site about it. And I moved the patches, did a little differently using a whole body patch approach. And I now have reduced my pain about 80 to 90% at night, which is just incredible and phenomenal.
So Dr. Patty, can you unmute yourself and explain this thing called GHK copper peptide? Explain this thing called stem cell, like from a doctor perspective, what does this all mean?
Well, I went to medical school midlife. It was my second career. And I went because I wanted to get sort of the credentials of Western medicine, but I had always studied all different forms of regenerative and integrative functional medicine. And so I kept doing that on the side. And in the process, when I got done with medical school, worked at Kaiser, sort of in a traditional job for a while. And then I'm in preventive and occupational medicine, environmental medicine, and internal medicine as well. But I wanted to do more of the regenerative and functional medicine. And so that's what I began to do. And we were doing stem cells, for patients. We were doing injectable peptides like GHK copper. And so that was what really pricked my interest about the patches, because the stem cells now are no longer available in the United States like we were using as of about 1.5 years ago. And I thought, wow, what a wonderful thing to have a patch that could activate and enhance your own stem cells. So much less expensive and certainly no needles. What a wonderful thing. But could that possibly be true? Was going through my mind. And that's when I began to do some investigation and realized we did have about 70 studies around all of this technology. And I became convinced that it was safe and effective. Same with peptides. Peptides are, just short chain amino acids we make in our own body. And if we can enhance the working of those, what a wonderful thing. And GHK copper was one of my favorite injectables. I used it as an injectable for myself and for my patients. And it's very effective, but it's expensive and it requires a needle. And many patients don't want to use a needle on themselves. So a patch is super, super good. So I love the safetyness. There's not actually GHK copper in that patch. It's activating your own body to work. And I love that because that makes it safe. And then if we see the effectiveness of it, we're just very happy with what we're doing.
So when you say that in clinic, you used to, this blows me away. She's an MD, so she can do injectables, right? Dr. Patty was doing stem cell injections. And just wondering, I didn't really say this, but you can wear one of these X39 stem cell activation patches, if you look at that, for about less than a cup of coffee a day. We're talking $100 a month for 30-day supply, something like $3 a day. You can activate your own stem cells. Reasonable. Okay. We're not way overpriced. So when you were doing stem cell injections, what does that cost?
So we use stem cells as injections, would be several $1,000s. We use stem cells as IVs, same thing. And also we use stem cells intranasally back up towards being deposited right at the base of the brain for neurological conditions. And so all of them, anywhere from $1,500 to, maybe 10, 15,000. They're expensive. It's very expensive to use those.
And then in the United States, just to understand this, MDs cannot inject stem cells anymore, or what's that?
No, if you can go to a physician that actually draws stem cells out of your own body, like your bone marrow or your fat, and redeposits them back into your own body the same day, that is still legal to do. But we were using stem cells from sterile C-sections that, cord blood and we know that cord tissue and cord blood are very effective. And so that's what we were using, and that is not allowed in the United States to be used anymore in that way.
So if you want to get stem cells that are not from your own body, you're out of country now. You're going to Mexico or something. Is that correct?
Yes, or Europe. Most countries still do it because it is safe and effective, but it is of course, much more expensive because there's so much more involved in it, so much more technique in administering it, so much more liability insurance that the doctor has to have to do it, and all those kinds of things. So it gets expensive.
So did you find that that was an effective way of resetting? Or I guess I've always wondered what the difference is. I mean, the price, of course, but that this is activating your own stem cells all the time. And, I would think that stem cells, because our own go dormant, so this reactivates them to work again. I would even think injections, aren't going to live forever. Like those are going to because they're not being activated, there's nothing telling them that to continue to work. So I would think that they would have kind of a short lifespan.
So it depended on the patient. Part of what they did was not only introduce new stem cells into your body, but also activate your stem cells too. So it was both. But for the most part, for people with serious conditions, we were recommending it maybe even as often as every quarter or every few months. I was doing it every quarter because I have MS. Sometimes injections for younger people could last for years. And then other times, maybe every year or two, you would need a new one.
A booster. So what I think is interesting is that you said for young people, it could last a lot longer because young people are still, their stem cells are still being activated by their own body. But the older people needed injections every 3 months. So what's interesting about that is that it makes sense based on how David has made the X39 work, which is it's activating your own stem cells, right? And so once again, stem cells aren't dead, they're dormant. And so this gets it activated again for a whole lot cheaper. And what does it mean, Patty? You always talk about stem cells act like honing birds. What's that mean?
So they are just tuned in to hone in on inflammation. And so when they go to your when they're introduced into your body, they're going to just move, very carefully and decisively into the areas of greatest inflammation, which is what sometimes we see with the patch doing, and maybe someone doesn't feel better all of a sudden because we know it's going to an area, or at least I believe that with what we know, it's going to areas of greater inflammation. Maybe a liver's inflamed and you don't feel it, but that's where the stem cells are going first.
And then it will march to the next thing and the next thing. David says this, when you put young stem cells on old tissue, you turn the tissue young again. And I don't know, there's a lot of new people on the call, I can tell today. So you're like Timothy's just starting. Some of us have been on the X39 for 3 years now. And I will tell you this, we all started it. I did not start it to reverse my tissue age. I had no idea. I just was looking to feel good again and reverse some of the, honestly, for me, some of the symptoms of cancer, and, but to my delight, 3 years later, the skin looks great. Like the elasticity of the skin after being on X39 is no joke. It changes, it gets young again. It doesn't, I'm just going to say personally, you get shine again. The elasticity around the jawline goes back to like a young person, and you don't have the turkey neck anymore. I mean, just pay attention, ladies. I know guys don't probably really care, but you should. But I mean, I just think it's Awesome. So let's go ahead real quick. I want to, before we move on to a few other patches, I just want to say how to wear this. You put this on below the back of your neck or underneath your belly button. Really, any spot will do because our whole body's light. The only rule is 12 hours on to activate and repair and 12 hours off. Let me say that again. 12 hours on to activate and repair and 12 hours off. This is because this is light. And if you wear this 24 hours over and over and over again, your body gets used to the signal and it doesn't work so well. So once again, the only rule is 12 hours on to activate and repair and 12 hours off. I have to tell you what Ted says. My turkey neck is about half as pronounced. And I've been on the patch. I missed it. I can't finish reading it. I love you, Ted. My turkey neck is about half as pronounced. I've been using the product. I've been using the product 6 months now. Okay, so Dr. Patty, let's talk a little more about symptoms of MS and a few of the other patch technologies that you like and why.
Yes, well, I think it's really important to use X39 and X49. Those are always our base, our go-to, and I think the synergy from that to some of the supporting patches is very phenomenal, really. And again, you know, I'm just sharing this with you really today as a patient and sharing with you what I do with my patients. It's sort of a physician, heal yourself, but I'm a patient and a physician. And I hope my suffering and some of my symptoms that are very uncomfortable maybe can be helpful and be of some good and for this world and the glory of God. But I'll be happy to share anything I can. I feel like that for me, one of my biggest symptoms of MS is pain. And it particularly was bad at night. And so when I started in with the patches, I started in with X39 and Icewave, or what I started with. And I was just blown away by the way that Icewave works so effectively. For me, the first night, about 50% of my pain was reduced. And then the second night, I moved it around a little bit. There's great information on site about it. And I moved the patches, did a little differently using a whole body patch approach. And I now have reduced my pain about 80 to 90% at night, which is just incredible and phenomenal. Wow. And I have a news story about shingles, and I'll tell that maybe later if we have time. But I do think that Icewave, because it interrupts that pain signaling pathway, and it works with sort of the white patch and a brown patch. So there's that electrical connection as well, and it interrupts that, and it's just amazing.
So let me explain how the Icewave works, and then we do want to hear about shingles. I mean, who doesn't want to hear about shingles? Okay, so I don't know why, but I'm just happy today. Do you ever have a day where you're just happy? Yeah, it's just funny. I like happy days. Okay, so let's talk about Icewave. So you put the brown patch where you hurt the most. Where do I hurt? Well, a lot of you know I broke my wrist. So my wrist hurts a lot. So boom, you put it right where it hurts. And you put the white patch, you know, kind of 3 inches away, you know, or I like to say where it doesn't hurt as much. I like to say what I do with Icewave is I block my pain, or I bookend my pain. Does that make sense? Bookend your pain. That kind of makes sense. You know, where am I gonna, where's my pain and how am I gonna bookend it? Because what this does is it works like a battery charger, right? Have you guys ever used a battery charger? You know, negative on one spot, positive on the other. David says pain's in the connective tissue. So you break the connection of pain with Icewave. So that's what I believe. Dr. Patty, where did you put your Icewave? Oh, there you are.
So, yep. So the protocol recommended on the website is what I started with. And I put 2 patches, one under each foot, the white on the right, the brown on the left. And then I used, I started on my wrists and then ultimately moved up to right here, sort of on the side of my elbow. And then sort of alternate a bit, but mostly use now up at the shoulder. So it's like I've got 2 on my shoulder, 2 on the bottom of my feet. And I bookmark all of my pain, and it is very effective every night.
It's interesting that you should say that, because that's a new word. You guys might want to write that down as practitioners. Bookend the pain. What does that mean? I bookend my pain. Dr. Patty bookend her pain too. She just has full body, she has pain. You ready? From the shoulders to the feet. So what did she do? She did a set of ice waves on the shoulder, and she did a set on the bottom of her feet. She bookended a huge spot of pain for her. I think that's really good, Patty. And so that is ice wave. And so of course, ice wave is going to cut the pain. It's not going to repair, right? X39 is your reparative patch. But shoot, isn't it great to get rid of pain while the X39 repairs? But David has talked about it calming the nervous system down as well. And I think that's interesting, because there's a lot of nervous system issues. So in that way, you're going to calm the nervous system.